Good afternoon, everybody. Wow, that was louder than I expected. It's such an honor and privilege for us to spend a few minutes with you this afternoon. We are really excited to dig in to the intersection of innovation, venture, and clinical care delivery, and specifically women's health. So this is a really broad, robust topic that's so timely when you look at the current environment and the current opportunities we have to make a difference and impact. And so today we're going to try to weave our way through a number of topics that ultimately will end with some big ideas around how we can change what the future of women's health looks like. So thank y'all for spending some time with us. My name is Hank Capps. I'm a family physician. I'm the EVP, Chief Information and Digital Officer at Wellstar Health System, which is about an $8 billion community and academic health system in Atlanta, Georgia, and beyond. I'm also president of Catalyst by Wellstar, which is our innovation company and venture fund. And we'll tell you a little bit about that and how that integrates with the innovation and clinical care delivery work. We have some incredible panelists here today who have joined us with backgrounds ranging from startups to leading one of the biggest and most important service lines at our health system to our leader of innovation for the health system and the head of innovation for our innovation company and venture. So this is a stellar crowd of amazing people, and I'm going to let them just briefly share a little bit about themselves and then share with you one of their big passions for healthcare. So with that, Caitlin, you sat in the first seat, so I guess you get to
I'm up first.
Lead off. Yes.
Okay. Hi there. My name is Caitlin Christine, and I'm the CEO and founder at Gabby. And what I'm most passionate about is early detection as the cure for cancer.
Hi, I'm Paula Graves. I'm an OBGYN, and I'm Chief of Women's Health. I knew I was going to be the one with the hot trouble microphone. That's okay. I get to drop the mic at the end. So.
Felt like you just dropped it at the beginning.
Hey. So I'm Paula Graves. I am an OBGYN, and I'm Chief of Women's Health for the Wellstar Health System. And I am passionate about the vision and mission motto that we use for our service line, and that is every woman, every time. Because every woman deserves to be cared for every time.
All right.
Testing.
You don't
okay.
have the mic.
Hi, everybody. Thank you so much for having us. My name is Jamie Clark. I am the Head of Innovation and Venture Strategy for Wellstar. And my passion is to rebuild the system where being a woman is not a baked-in disadvantage.
Hear, hear. So with that, we're going to just jump right in, if that's okay with all of y'all. When we think about women's health, a lot of times the conversation gets limited to reproductive health related topics. And we hear about fertility and pregnancy and contraception a lot. But there's a whole lot more to the health and well-being of women. And I wondered, and I'll start with you, Dr. Graves, what are some of the biggest opportunities that you see to help women be healthier?
Excellent question. And I don't want to minimize the fact that we are currently in the United States focusing on reproductive health. We are right now in a crisis in that, unfortunately, the U.S. has the worst rate of maternal mortality in developed countries. So it is definitely very important. However, I think it is also important to understand the impact of women's health for our society. So when we think about women's health, it is a continuum. If you just look at from childhood, first period, reproductive stage, midlife, menopause, and beyond, women go through a lot, and it is a continuum. It is not interrupted stage that are not melting into the other stage. And so even though we focus on reproductive health, women lifespan for the average woman in the United States is 78.3 years. And yet, we spend a small portion of our life in that reproductive stage here. 40% of our lives we're going to be spending in this midlife crisis. That is a time of great changes for a woman as far as career, raising children, and also some of chronic diseases start to come up during that time. And so it is a very important and impactful time for us to focus on, and we don't. You know, recently we're hearing things about menopause, but we are not educating, we hardly educate on that topic. So for me, as Chief of Women's Health, and all of my colleagues, it is important to start educating way before we get here. So we start educating on a young woman from when she has her first period, and our boys also. Our boys are also going to be making decisions in healthcare. We want them to be responsible men, that together we can really move the needle when it comes to women's health. So all of those things are impactful, and so we need to focus on that. There are a lot of statistics that I'll, probably, if I have the opportunity to talk to you about, as to why the MVP of our society deserves for us to focus on women's health. Because when we invest in women's health, we are investing in an entire community.
That's right. It's so well said. I mean, and I think you tee up a part of the problem and opportunity, because we need to be innovating more. We need to be investing in women and women's health more, and holistically, as you said. So, Jamie and Caitlin, when you sit in that chair of innovation, and you're thinking about the opportunities that we have going forward, what should innovators be thinking about today as it relates to both women's health and healthcare broadly?
Take it. So I think there's countless problems in healthcare, which is probably why it's one of the focus of Aspen Ideas. There's a special segment for health, because we all know that it touches every single one of us. We're all consumers of health. We all have a hand in designing health. But interestingly, the foundation of healthcare, it wasn't originally designed for women. It wasn't built to take care of our unique needs, because we can see how there has been no funding for research. There has been little to no understanding or taking seriousness in terms of what women are going through in every stage of their life. And so as innovators are coming to the table and thinking about where we should play, I think from a health systems perspective, we should take a broader look at how this system has been designed. And for example, the economic model of healthcare has not been really set up for us to innovate. So one of the things that I always like to kind of bat around is how, because health systems and hospitals have to stay relevant and stay afloat, providers have to get paid, we have to have 15-minute visits. How are we supposed to talk about everything in a woman's life and every point of care in 15 minutes? And so if we could start thinking about partnerships and leveraging all of these amazing technologies out there to make the most of what we're handed in the 15 minutes, then that's where the innovation and the investments should play. But it's not just, to take another step back, it's not just about the health of that one woman. Dr. Graves alluded to it. It's really about investing in the workforce, investing in your communities. One of my favorite stats is for every dollar earned, a woman invests 90% of it back into her family and her community, opposed to 30 to 40% of her male counterparts. Yeah. And if that's not the math for you there, then...
Yeah, and it points back to your MVP. I mean, and the reality of the contribution that women make so comprehensively. I want to just bounce off a little bit around the way health has been built in the USA. Because, we're talking about entrepreneurship and startups. I'm going to describe the business that was built 50, 60, 70 years ago. Basically, we have the whole economic model being built by a business, healthcare, a lot of it not-for-profit, some for-profit, that the revenue is fixed by a third party. It's set by commercial payers, by the government. And the expenses follow the market. So they shift with what the market's doing, which produces an average operating margin for a health system of 1% to 2%. So how many entrepreneurs in the room sign up to start that business? And I think that systemic model of care that has been ingrained, that we have not been able to break free from, despite many small tweaks along the way, have also led to a lot of what you've been talking, what both of you have talked about, both the problems and the opportunities. And so we collectively, I think, have to be more ready for bolder change, because the small incremental changes haven't worked. And that business model that's been built, that we just shake our heads that it can't change, it has to change, because there's no way for us to revolutionize the way that healthcare is delivered without all of the pieces and parts working together. So,
if I may add on to that, on top of that, in the United States, we've built a healthcare system focused on disease and treatment of disease. And so where's the opportunity to radically change our healthcare system? It's with prevention and early detection. There are actionable things that can be done to prevent to prevent breast cancer, specifically, because that's my expertise. There are actionable things that can be done to ensure an early detection, but instead, we have a one-size-fits-all screening program for women in the United States. And that just doesn't work when you may have a high risk of breast cancer, or you have extremely dense breast tissue where a mammogram is not going to identify your breast cancer. And so where I think there's a huge opportunity in the United States is really to focus and shift our energy from disease and treatment to prevention and early detection.
So Caitlin, just to share with them a little bit of your story and why you're so passionate about that.
Sure. Wasn't sure we were going to talk about that. So I am incredibly passionate about early detection of breast cancer because my mother died of a delayed diagnosis. She was getting her annual mammograms every year, and she had just had her annual mammogram and it was clear. But it turns out she was high risk and her OBGYN never talked to her about it. And she had extremely dense breast tissue, something her OBGYN never talked to her about. And what that meant was that the annual mammogram she was doing was never going to find her breast cancer. So when it was found, it was in every organ, and she was gone 7.5 months later. Fast forward, and I found lumps in my breasts. And 1.5 years after my mom died, I was diagnosed with breast cancer at 24 years old. So I became passionate about early detection out of a need to not see any more of my family members die of cancer, out of a need to not see any more friends die of breast cancer. And the hardest thing for me to grapple with was there were things that could have been done.
Well, and that connects back to when we're talking about healthcare, we're talking about people and their lives. It's a different conversation. And I think that personal story, and thank you for sharing your personal story, I think is really important to set that stage for why all of these things that we're talking about today are more important than just a business model, or more important than just about innovation, or more important than just about venture. And we're going to talk about all those things. But it is, at the end of the day, what we're trying to do is help people be more healthy.
And Hank, I just wanted to piggyback because, we're talking about the XX factor. And it's not only about healthcare in the United States, it's really bringing it down to basics. Even though, women make up 51%, 50.5% of the population, when you look at research money and innovation, only 2% of research money is invested in women's research and 4% in investments. Why is that important?
That's worth, I think, pausing
Yes.
to really ingest.
Yes. And why is that important? Because women, this is statistical, women make up 80% of all healthcare household decisions. And yet we are not investing in the one person that could be pivotal to change the entire community, because women drive all of and take care of what we call a sandwich generation. 65% of unpaid caregivers are women, okay? Women spend at least $15.4 billion more than men in out-of-pocket expenses for health care. And when a woman is taking care, when we talk about 80% of those decisions, they're taking care of several generations, their children, their spouses or siblings, and the parents. And more importantly, women deliver 100% of our future. Mm-hmm. Okay? That's
hard to argue with that statistic.
Mic drop.
No, not quite the mic drop.
Yeah. You keep dropping the mic, is all I.
So that's just to say, when we are here today, there is an importance in investing in women's health. You invest in women's health, you're investing in the future of our society.
Mm-hmm.
So it's a perfect segue to you, Jamie. Why exactly would a big health system start investing in startups and early stage technology? What's a little bit of that story, the why?
Yeah, I think before we talk about why health systems should invest in startups, we should just talk about the state of corporate innovation today, because it is so hard, but yet so required. You know, with the evolution of technology, the average lifespan of a company today is about 12 years. And 60 years ago, it was 75 years. So we are seeing this turnover and the need for companies to address these evolving market dynamics, address consumer expectations changing, compete, and for a health system who's been a rock in the community and been around for a while and has not seen a lot of change, as we all know, health systems, to say, actually, we're going to disrupt from within. We are going to find the earliest of early ideas, the entrepreneurs that have built companies off of their lived experiences, and we are going to invest and partner, and then we are going to bring along those ideas into our facilities and our stakeholders and test and really design those care models together is quite rare. There are many approaches to innovation. You've seen companies acquire other organizations, you've seen them launch venture funds, launch private equity funds, and everybody has their own kind of approach to doing it. But really, I believe what makes us unique is acknowledging what we do really well and acknowledging that we should not reinvent the wheel for everything, and leaning into those partnerships when they're available and really being able to say, okay, let's roll up our sleeves and design something together. So, you know, in order for a startup to be successful in any organization, they need two champions inside the company. And if your organization has an innovation team or a venture team, it can't just be them. It has to be them alongside the stakeholder impacted or somebody else inside the organization willing to hold their hand and champion them through. And that's why I was so excited for this opportunity, because partnering with Gabby was not ever going to be possible until Dr. Graves saw the vision and said, yes, let's do it. This is a need. Let's make that impact happen. And so investing, of course, is a financial assessment and looking at returns and looking at the business, but it's also looking at the clinical feasibility and the validity of it. And that's something that we all had to do and come to the table together.
So what was really the thesis that launched Catalyst and this effort that you built about 4 years ago now?
Sure. So yeah, 4 years ago, we launched the innovation company and venture fund of Wellstar with the thesis that, one, not all healthcare problems are solved by healthcare solutions. And we know we need to look at who's doing it right out there in the industry and raising those consumer expectations and matching them. And then second, if we are truly going to innovate, we can't do it alone. And the ones that are actually hands-on, closest to the patient, need to be designing the solution. And that's why we not only deploy capital, but we have another team whose whole responsibility it is to bring those companies into the fold, into the facilities, get them access to the caregivers on the front line.
So what's it look like when you work with a startup, whether it be Gabby, and Caitlin can tell her story of what it's been like to work with too, but how do you picture that? And that's really both Dr. Graves and Jamie, I'd love to hear your perspective about, like, you've got this startup, it's this emerging technology, it's not perfect. We live in a world where zero harm, we're 100% risk adverse for good reasons. You want your health system to be that way, but how do you actually work with a startup and bring those new ideas into that corporate environment?
So I think for me, being chief of women's health and an OBGYN for many years, just looking at the problems that continue to affect women that I could not solve for. Heart disease, cardiovascular disease is the #1 killer in women. We know that. The symptoms are different. We need more science to understand how can we accurately diagnose heart disease. Breast cancer, 1 in 8 women develop breast cancer, and we're seeing the age getting younger and younger. We see cervical cancer, which is a health disparity type of cancer because of lack of resources. So it is very frustrating to just sit there and watch things go, and we're looking at traditional medicine. And all of don't get me wrong, we are in an amazing country with amazing, development. We live in an amazing age where we see a lot of innovative healthcare solutions, but it is very slow, and especially when the research is not necessarily targeted towards women. And so we have always leaned on a lot on traditional medicine. How many of you now are seeing a difference engaging in non-traditional medicine at this point? We cannot continue doing the same thing and expect a different result. And so here comes now out the box, innovative way to look at solutions. And I think that the key is to develop a relationship with these companies in which there is the speed of trust. We develop that trust, we validate some of the processes, and we are flexible. Just like when you get a new partner in a dance, we're going to step on each other's toes for a while. We don't necessarily trust that other person, but then as we learn, and it's a yin-yang in which, okay, I'm not sure because traditional medicine calls for years of, all of these methodologies that are not necessarily proven. And so we start doing that, and there's a trust, validation, and then we continue. And I think that was the key. So, and the third thing is not only the relationship with the company, knowing that they have my interests at heart, because we want the ultimate outcome is for cure for disease. And so they're going to be validating step by step. And then to have a company in which is, all of those validating steps, willing to take those steps with us, knowing that at the heart of it is patient care. And so a lot of patience is required. So,
but now we're tangoing, right?
Yes.
We can do it. We're waltzing.
We're the best tangoers.
Not a simple
should see
dance
us
anymore,
dance.
is that what you're saying?
Salsa, not necessarily a tango.
I would do none of the above. So Caitlin, tell us what your experience is interacting with a health system, interacting with local care when you're building, a national platform.
Well, I have to be honest. Initially, I had no interest in partnering with health systems. And the reason being, I thought if we're truly going to disrupt this care model and how early detection happens, we have to do it on our own. We have to we have to change outside the system because the system is broken. And what I learned was that is absolutely the wrong approach. And actually, by partnering with a health system like Wellstar, we have been able to reach more patients than we ever could by ourselves. We have the opportunity to do more research together than we ever would have been able to by ourselves. And so for me personally, it was a big learning and being willing to be wrong and learn from the process. And part of that process was realizing that by having a partner like a large health system who believes in innovation and believes in treating the woman and giving her care every time, that together we can be more powerful and have greater impact. And so honestly, I mean, there's so many things we have yet to talk about on how we can really influence and impact the lives of women at Wellstar and in greater Georgia. But we're really just getting started on finding these younger women. And who knows? I mean, maybe we'll be marching on Capitol Hill and making policy change as well. But together, I think the conclusion has been that together we are better and we can actually touch more lives together. And then I would just piggyback on the trust comment. I mean, not only is it, Dr. Graves, you trusting the innovation arm of Wellstar, but it's you trusting me. It's you trusting Gabby, and that when there are hiccups, you bring them to me, and I'm going to want to fix them as quickly as possible, and vice versa. When I bring you any issues, that we together, with our end goal in mind of saving women's lives, that we trust each other to do that.
And I think that as we trust the initial process and innovation, it really energizes us to, okay, what's the next big idea? What's the next problem that we can solve? So just for you to know, we're not only addressing breast cancer in younger women and Gabby. We have also, the biggest word out there is menopause. And so, surprised y'all are not cringing all at once. But if you look at the fact that women at their prime are seeking answers for a process that is supposed to be a natural process with a lot of changes, and we don't educate hardly on menopause. And so we are also partnering with Catalyst and other innovative, with Electra, another innovative thought program to bring solutions to all women regarding the perimenopause area. And that's, so I'm just excited about this period in our, no pun intended, this time in our lives. And my hope is that other systems will see the validity, the vision, and embrace this.
So true. So Jamie, I want to go back a little more tactically, like, what does the innovation team actually do when you're doing this? I think you're building companies, you're doing proof of concepts, you're doing pilots. Just tell us a little bit about what that looks like, because we've heard the perspective of our clinical leadership, we've heard the perspective of a startup, but there's orchestration happening in the background that I'd love for you just to share a little bit about what that looks like and the type of work that innovation takes on.
Sure. Well, when you do one pilot, you really are just doing one pilot, and those learnings sure can be translated, but every time you work with a new startup, there are new challenges and new stakeholders, and especially innovating inside a health system that is traditionally traditional, with providers and physicians that have had their standard of care and that are maybe not as welcoming to the fast-paced evolution of consumer expectations and technology changes. And so what innovation really looks like inside Catalyst is a lot of change management at its core, and a lot of research, and really a lot of conversations outside, understanding who's innovating, who's out there really kind of building the next platform, and then coming back and building those trust relationships, as Dr. Graves alluded to, with our internal stakeholders as well. And so, the team spends a lot of time in that early diligence So we have a venture diligence process that is quite unique, because not only are we running that financial assessments, but we are really hand in hand looking at what would it look like to bring this to life. How can we get creative with partnerships and structure them in a way that it's a win-win? You know, partnering a multi-billion-dollar health system with a small startup can oftentimes be daunting to both the startup and to the service line, where they want to understand what's in it for me and what's in it for my patients, and how can you really kind of create an experience under this giant umbrella of what an organization already is, that brings in the best of the ideas from the startup as well. And so it requires a lot of hands-on work and massaging and collaboration, and a lot of failures too. You know, you have to test and learn. And I loved the panel, Nancy Pelosi yesterday. She said she didn't like I didn't like the word failure. I'm going to call it an attempt. I might take that.
Learning. It's a learning experience. We don't fail, we learn.
But you have to, it's currency, and so you have to take on those chances, and the innovation team was really designed to do that. So we recognize that alone, the system cannot take risks. They can't design pilots to just learn and fail. Mm-hmm. They don't have the time or the resources or the dollars to do that. And so that's what Catalyst is. We really take on a lot of that risk and allow ourselves to iterate and pivot and spend resources where the health system cannot.
I think something that was really important that Wellstar and the Catalyst team did impeccably well was setting expectations of learnings.
Yes.
And actually, I know Preston Hendrickson, who's VP of Women's Health, will say over and over again, and I love it, that we're learning. We're starting out. This is a new product. This is a new phase. This is a new launch. So we just need to learn. And I think that was critical in setting the expectation for all of us.
And I think it also it is very important. We need to understand the mentality of the provider. Okay, there's been a lot of mistrust with pharma, with big pharma, and then tradition. And so change doesn't always come easy. We're going to have to learn to pivot. We're going to have some paradigm shifts. Mm-hmm. And so as chief, that's my responsibility mm-hmm. and my job, along with Preston's, is as we look at this venture and as we can see the end result. We can see women being cured or just their quality of life improving. How do we take the provider along with that vision, knowing that traditionally, sometimes that can be a barrier, and so we have to be patient as we do this paradigm shift.
So one of the things I think I'm hearing is that none of this happens accidentally, that there's a lot of work from a lot of stakeholders, mm-hmm. And getting people aligned around the destination helps make a huge difference in being able to mobilize and do that test and learn work that can be so complicated. Well, I'm going to shift gears just a little bit from the venture investment side to some current issues in the women's health space. I just want to spend a minute on pain. We hear a lot about pain, both in social media, the media, from patients. It's incredibly complex. It's a clinical topic that all of healthcare has struggled with. But in particular, there's been really a multi-generationally maintained perspective that a lot of pain that women experience is just normal. And, as we think about the future of women's health, it's incumbent on us to challenge that position and to think about what are the ways in which we need to address pain in the context of women's health, and that it isn't just normal always with pain at menses or pain at an IUD insertion that we've heard a lot about recently, or even childbirth. And these beliefs come from family members. They come from people in healthcare, unfortunately, at times. Mm-hmm. They come from friends, and it's an immense amount of pressure on those MVPs that you were talking about earlier, around how that pain is managed in their health continuum. So I'd love to hear perspectives about how we should address that.
So again, part of the problem is that we don't spend enough and invest, I shouldn't say spend, because it pays to invest. It doesn't cost to invest in women's health.
Hear,
Okay?
hear.
And so I dare say that if men had to deliver babies,
There wouldn't be any babies.
Yes.
population drop, but additionally, just deep studies on the science behind pain. And so that is part of the problem. We depend on a lot of folklore. There were a lot of barbaric experiments years ago, not only done on women, but specifically in African American women. And so there's a perception of who can tolerate pain better, and therefore it's not really pain. There are studies that show that one specific study on cardiac surgery, and that women tended to be prescribed sedatives as opposed to prescription medication, opiates, for men. There is, for childbirth, there's a perception that, well, women have gone through all their lives, tolerating menstrual cramps and childbirth, so their tolerance is higher. All of that is rubbish. I hate to, I can't find a better word. What we need, again, so even though you pivoted from other innovation, but it's still the same theme. It is investing in research for women. It is barbaric to offer an IUD insertion and then shame a woman into, oh no, you can do this. You don't need any pain medication. There's also a lot of inaccurate information regarding, I'm going to use an example, epidurals. Whole myths, you get an epidural, your baby's going to have a defect. If you have an epidural, it's going to mess up your back forever. If you get an epidural, it's not natural childbirth. And many of these things are things that have been imposed on women. Again, invest in the MVP of your society. Invest in the person who can change society for better. Every day she does. So that's all I have to say about the pain issue. So I don't know if you have...
Yeah. A lot.
Yeah, we have a lot to say, but we have limited time.
Right.
I mean,
Go ahead, John.
one of the big problems too is the time to diagnosis, because we don't take pain seriously. Average time to diagnose endometriosis is 7 years. Mm-hmm. And what I'm personally excited about, though, being on the innovation side of the house, is how we are investing in early diagnostics. We're investing in biomarkers. We're investing in these solutions and technologies where we can actually look into some of these chief complaints that are being lifted and not just dismiss chronic menstrual cramps as, oh, that's normal. Yes, everyone goes through that, but actually start to diagnose things and treat them.
And listen from the very beginning, right?
Yes.
Honoring every voice. So, one of the other issues of today that we heard about last night at the Big Ideas, which I think resonated with all of us, was that everyone's an expert. And, that big idea, boldly saying, let's embrace it and figure out how we can help those experts be experts and provide the best advice, and that those closest to the patient, who oftentimes are either doing research or taking care of patients, haven't spent the time or focus to be that voice, is a big opportunity. And in women's health in particular, we can look at the usage patterns of social media and generational usage patterns and say, wow, this is a place that we could make impact. I'd love any perspective y'all have on that big idea.
Well, oh, God. No,
Go ahead, Gail.
Jamie.
I think if we could open up access to care, women won't go looking in the deepest, darkest pits of Facebook. And if we could actually bring care to them, you know, women are being faced with, do I take my kid to soccer or do I go to the doctor? Do I take time off and travel an hour? Or, you know, and so these balances that they're having to do in their day-to-day, in addition to running the house and working, they're just kind of unmanageable. And so if we could start opening up access and taking care actually to them where they are, in your place of work, challenge your employer at when you go home, say what options do I have for when I need to when I have chronic menstrual pains and I need to go see a doctor? What options do I have when I need to go get my mammogram? Is that paid time off? Those types of things. And it really should be incumbent upon every member that we're paying into the system. It should be incumbent upon your employer, among your community, among your village, to help you get that access.
Dr. Graves, I think you need to tell the yogurt story.
No, but okay. You put me in a
Sorry, I
tough.
put you on the spot.
Well, who validates TikTok? Who validates these influencers? We barely validate what our doctors have to say. We barely validate innovative technology. But yet, if someone on TikTok says, or it doesn't have to be TikTok, that, hey, if you have a yeast infection, you know, yogurt is a good solution, but how to take the yogurt, for instance, is placing it vaginally. And no one questions that. No one understands that the rationale behind yogurt is that the biggest immune organ in our body is our gut. And so by ingesting yogurt and the different cultures that are in the yogurt, you help stabilize the pH of your body, the pH of your blood, the pH of your vagina, and therefore you help fight infections. Instead, you have people who are coming up with no valid research, and then you have a whole host of people, some patients who are coming into my office, and I'm surprised to see a dairy product in a most unusual place, and to have to educate to that. And thank God that we do have very sensitive providers that that can embrace that woman at the time. But the bottom line is this: we who, shame on us as providers. If we have the knowledge, if we have the passion, we need to be the influencers. We need to increase that volume so that we can educate our women, who are therefore going to go ahead and educate their children and the community. So I love the presentation, but it really drove a point. It hit a spot, and we definitely need to do something about validating the true influencers in our communities.
That's right. So we're running out of time, so I'm going to shift to the final question for the panel here, and then we'll have just a minute or two for questions from the audience. So I want you to put on your futurist hat and look 10 years into the future. What will feel completely unthinkably archaic 10 years into the future, and what's your big idea to accelerate toward that future? We'll start with you, Paula, then Caitlin, and then end with...
access to care. The MVP of our society spends time caring and taking everyone else and caring for everyone else. Care needs to be convenient. Care needs to be brought to our women. And so ideas such as mobile units, flexibility in the workplace, policies need to change. When I look at recently, there's last month FDA approval for a new pap smear in-home process. So years from now, because like I said earlier before, cervical cancer is a cancer of disparity because lack of access, lack of convenience, lack of time. And so that's my dream. I want every woman every time to be able to have easy, accessible, and affordable care.
Caitlin.
And I would say that late-stage breast cancer is obsolete. No longer does anyone die of breast cancer, that it is always caught early, and you survive and thrive because, one, every woman knows her risk of breast cancer, and two, she has a personalized care plan that tells her exactly what she needs to do, when, and how often, including screening. So it's not one-size-fits-all screening for women, but based on her risk level. And then three, finally, that there's access. The number one feedback we hear from women who struggle to go get a breast MRI or a mammogram is cost. And so that the payers are covering these necessary screenings for women based on their risk level.
You're here.
Absolutely. And I think we have all of those pieces to the puzzle. You know, we are in the midst of a great wealth transfer. And by 2030, women will have received over $30 trillion of wealth from their spouses. It's no longer going from children to grandchildren, it's being transferred over to spouse. And so women will now be in control. We'll have more power. We get to set the priorities. We get to set the direction of the capital. And we need to actually take advantage of the moment in time that we're in. And I guess then, since we have all of those pieces to the puzzle, my big vision would be that this time in 10 years, we don't have to say that women's health is a niche, and we don't have to say that it's a benefit perk, and it's not a kind of side investment strategy, that it is part of the core of every single organization and community and how we invest in our MVPs.
Yeah, so, I mean, absolutely. You know, when we think about the reality of women's health being just health, I mean, even this room that has 12 guys out of about 115 people, at least the last time I counted.
Good for the guys.
It shows,
Yes,
well,
absolutely.
it's the same
Educate
type
our
of
men.
percentage that points to the level of priority across every person in our country and in the world to really change the trajectory of this. And so I love your three big ideas, because I think that, one, we can do it, but it's going to take everybody in the room and a lot of the people not in the room.
Yes.
Amen.
And with that, we have, I think, 2 minutes and 38 seconds for questions. So why don't we start right here in the front row? Kim, I can see your name, so I'll say it. Hello, Kim.
Thank you. Hi, I'm Kim Smith. I'm the founder of Health Evolve Technologies. We build a digital health platform for birthing women, actually.
Oh, cool.
But and actually my question is around that. I left the hospital leadership world to jump into tech innovation. It's been a ride. But the question is actually why we're starting during the birthing period. I'm really curious about what you've seen, Dr. Graves, in terms of the connection with cardiovascular health and obstetrics. So that is our sweet spot. We're so passionate about addressing maternal morbidity as someone with lived experience that lost a daughter due to HELLP syndrome. So how I show up for my kids at 60 is important to me, but you got to start during the reproductive period or pre-pregnancy. So I'd love to see what you all are doing with that, what discussions are being had about addressing that connection between cardiovascular and obstetrics.
So our service line has also started OB, cardio OB program. So to your point, if we empower our women from when they start their periods all the way to menopause, and empowerment is education, access to care, research, then it is not only a matter of health equity. It's not a health equity issue, okay? It is an economic, innovative matter. So we need to start educating our young girls when it comes to diet, when it comes to exercise, from young. Cardiovascular disease is the #1 killer in women, but cardiovascular disease is also one of the big risk factors in maternal morbidity and mortality. And so education starts before conception, in which we educate our young girls as to how to care for their bodies, respect their bodies, et cetera. And then that will then follow through their reproductive age if they choose, and then beyond.
All right, we'll do one more question. I'll go to the back of the, I was going to go to the back of the room. Right there. Yeah.
Hi, thank you for this. My question is for Wellstar. My name is Katie. I'm the CEO of Rock Health. We work with hundreds of entrepreneurs who are as awesome as Caitlin. What business case did you make to get this off the ground? Entrepreneurs are struggling with this, and other health systems would like to learn from
good
what you've
question.
done.
You want to take that?
Sure. So I think it's important to design the win-win-win solution. And one of the ways that we brought to life Gabby inside the organization was to really fold their providers inside into our service line. So we designed a structure so that they actually are part of our medical group, and we're referring out and then in, and the benefit is across the board. So it's really important to design that seamless patient experience. It's important for it to be embedded into the clinician's workflow, and it can't be kind of that one-off kind of clunky situation where you're referring out and you don't know where they go into the abyss. So the business case there was it's a win for Gabby, and it's a win for our patients, and it's a win for Wellstar. Any more you want to speak to that, Dr. Graves?
I think we are actually out of time.
Oh, perfect.
All right, thank y'all.
Ask.